If your hip flexors constantly feel tight, maybe you're always stretching them, always massaging them using a massage gun, then this video is for you. We're going to go through some exercises and things you can do to relax your tight hip flexors. A common myth is that your hip flexors are tight because they're in a shortened position when you're sitting all the time. Maybe you sit a lot at work, in the car, and while this does put the hip flexors in that shortened position, it doesn't shorten the muscle completely to the point where it can't lengthen. Now, being on bed rest, being post-op, having a traumatic surgery to where you are stuck in this hip flexion position for a long period of time, think weeks to months, that is going to shorten the muscle. But if you're sitting and then you're walking around and then you're running, your hip flexors aren't in that shortened position. So the tightness you feel is actually your brain playing tricks on you. That hip flexor is actually a little bit weaker. It's putting those nerves on tension because it's weaker, and it's tricking the brain thinking that it's tight when it's actually weak. Now, tightness is very different from pain. If you're having pain, completely different rehab plan. Do not do these exercises. Go get a rehab plan going. This is for hip flexors that just feel tight. Runners will experience this hip flexor tightness because of the repetitiveness into hip flexion that occurs when you're running. And if you have weaker hip flexors, and they are going to appear tight. So let's get rid of those tight hip flexors. No more stretching, no more massage gun to the hip flexors. Let's get straight to some exercises that will help you. The first thing we want to do is actually test to see if our hip flexors are weak. There's no point in strengthening a muscle just to guess that it's weak. I'm letting you know majority of the time a hip flexor is weak if it feels tight when you're running or outside of running, but let's test it just to make sure. So you're gonna grab a box or a chair like so, and all you're gonna do is lift your knee up off the box, hold 10 seconds, and relax after the 10-second hold. You're gonna do this 10 times, repeating 10-second hold, and then relax, and then you're gonna do the same thing on the other side. Chances are you only have one hip flexor that feels tight, so you will notice a difference between the left and right side if one of the sides is weaker. I want you to pay attention to see if the hip flexor feels like it's fatiguing quickly, maybe it's cramping, or you feel some sort of tightness going on. Maybe it feels like it's burning because it is weaker. Notice those differences from the left to the right side. I want you to compare. Then if you're like, okay, this side definitely feels weaker, then we need to strengthen it. Before we go into some strengthening exercises, I always like to loosen up and go through some mobility movements, meaning we're taking that joint through its range of motion, because a lot of the time when someone has a tight hip flexor, they can't get their hip open and they can't get their hip into some hip extension. So let's open up the hip and then we'll go into some strengthening exercises. The first exercise we're going through is called hip cars. So you're gonna get in a quadruped position, and all you're gonna do is bring your knee out to the side, back, and down. We're gonna do about 5 this direction. Make sure you're not swiveling your hips, you're not rotating your hips as you do this motion. It should feel pretty good. It shouldn't be painful or anything like that. It's almost like a semicircle of the hip. Make sure you're also not arching your back as you do this. We'll do one more. And then we're gonna reverse it. So now you bring it up, out, down, up, out, down. Again, make sure you're not totally leaning your weight to the other side. Your back should stay pretty flat as you do this, and your hip should not be rotating on that opposite side. Good, we'll do one more. Good. The next mobility exercise is a plank to lunge. So I'm gonna get in a plank position. I'm gonna bring my leg up to my hand, rotate towards that side, and then bring it down, and then I'm gonna switch sides and rotate. And I'm gonna keep alternating, trying to sink my hips down and then twist. So one hip is going in a hip flexion, the other hip is going in a hip extension. The last exercise for mobility is a downward dog with a hip opener. So I'm only going to show it to you on the left side, but you're going to get in that downward dog position. And from this position, lift your leg up and over to the other side and down. You can tap a wall if you have it. near you, and down. So you're rotating your lumbar spine and your thoracic spine to open that hip up. We'll do 2 more. Now that your hip feels a lot looser, let's go into some strengthening exercises. So you're gonna need a medium to heavy weight and then a resistance loop. Let's start with the one with the resistance loop. So I'm just gonna place it around the balls of my feet. From this position, I can hold on to something or hold on to my hips. Now all I'm gonna do is march one knee up, bring it out, back, down. I call this barn door. You're bringing your knee up to hip height, keep it at hip height as you bring it out to the side, and then back down for 1 rep. Up, out, and down. Make sure you're not leaning your trunk over as you do this. A lot of single leg stability on the other side, and core strength, trunk stability, hip flexor strength, hip mobility. We'll do about 10 of these. You can do 10 on each side for 2 sets. When it comes to strengthening the hip flexors, if you're feeling a lot of tightness, you can do these exercises 3 to 4 times throughout the week. If you're not, you just notice a hint of tightness, you can add these to your strength training workouts, so it doesn't need to be a full rehab plan or additional exercises outside of strength. All right, let's ditch the band. You're gonna need a chair, and I'm gonna show you this on my other hip just to make it easier. But all you're gonna do from this position, hands on your hip, and you're just gonna lift up, hold, relax down. Same thing as the test that we did, just to see if it's weak. Now with this, if this is too easy, or maybe you notice like it's hard, but you could make it a little bit more challenging, I want you to grab a light weight. I'm gonna grab an 8-pound weight, and all I'm gonna do, lift, hold, and relax. As I lift, with just a little bit more weight, it makes it a little bit harder on that hip flexor and relax down. Make sure you're not leaning back, leaning to the side, compensating in some way. The goal is to isolate hip flexor strength with this, so if it's too difficult, your body's gonna find a way to compensate, and we don't want that. So you can do 10-second hold 10 times, just like the test. For the last hip flexor strengthening exercise, we're gonna go back to the band. Go ahead and put it around the balls of your feet and then grab a wall. I'm gonna lean into the wall, so make sure your butt's not sticking out. And all I'm gonna do is march my knee up and alternate. Have a lot of control with this one. Make sure you're not leaning to one side or falling over just to get that other leg up. It should be very slow and controlled. You're not rushing through this. As you do this, keep your ankle into dorsiflexion. This will keep the band on. If you want to progress this exercise, hold, 1, 2, 3, down. 1, 2, 3, down. Or you can use a heavier resistance band too. If you want additional tips or more information and resources on the hip flexors, I will go ahead and drop a podcast episode below where I break down all the hip flexors, why you're feeling more of that tightness or pain, how you can differentiate the two. So go ahead and check that out below in the Rehab for Runners podcast.